Hey everyone, Tony Maritato here, physical therapist. So I realize there are a lot of patients in this group who are getting discharged to home. Maybe they're having surgery in an outpatient surgery center, or they're not receiving home health care and they're waiting to start outpatient physical therapy. You're going home and you're thinking, what should I be doing? Now, while I can't give you medical advice, because after all, this is the internet, I've never met you, I have no idea what you can do safely and what you can't. I thought, you know what, let me just show people what I would typically do. Now I say typical because every case is different and every patient does something a little bit different. But I want to show you kind of a handful of my favorite things for somebody going home after surgery who maybe hasn't started outpatient physical therapy yet. I'm going to try to keep it as simple as possible. My philosophy has always been, give me the one or two things that give me the biggest benefit and let me focus on that. Okay, so that's what we're going to start with. So in terms of equipment, there isn't a whole lot of equipment you're going to need. I love these little half foam rolls. They're really inexpensive and affordable. This is something you should probably have prior to surgery because this is a great tool to use in a pre-surgical program. My other go-to is going to be a basic rolling pin. It could be wood, it could be metal, it could be marble. This one just happens to be metal, and this is a baker's pin. It's about 5 pounds, so the weight of the pin does most of the work. But anything you have will work just fine. It doesn't need to be anything special. In another video, I did a review on using rolling pins and one of the handheld rollers that I do really like. It's under $14, but let's begin. So I just saw a patient yesterday, wonderful lady. She was 5 days post-op. I was the first physical therapist that she was seeing, and these are the exercises that I recommended. So what we did was we started with the rolling pin, and typically, let's just assume it's my right knee in this case that had the knee replacement. We've got the dressing. There's all different kinds of closures and all different kinds of dressings. So I'm just going to stay real generic. But usually what I would do is I would have my client start with the rolling pin. We would do a little soft tissue massage. We would apply the pressure from what we call distal to proximal, meaning I'm pulling up toward the heart, and then I take the pressure away. And you can be as gentle as you like. A lot of times there's a tourniquet that's placed up around the thigh that causes some soft tissue injury, a bruising, throbbing pain sensation. So using the rolling pin is just a great way to kind of work through some of that discomfort. The leg could be relatively straight, supported on the floor. Once you've done 2 to 3 minutes of this, and you can be as gentle or a little more aggressive if you like, you can bring it down and do a little work through the calf muscle. The upper thigh and the lower calf are usually the 2 points that clients complain about soreness, muscle fatigue, pain, that really are not associated with the actual surgery itself. So if you're doing it, you bend over. Again, you go from low to high on the pressure, and you're just trying to make it feel good. You're just rubbing that tissue, facilitating fluid exchange. You could do it sitting. If you're really lucky and you have somebody at home who can do it for you, awesome. But 1 or 2 minutes on the calf, 2 to 3 minutes on the upper thigh. That is probably the biggest bang for your buck. What's going to help that tissue recovery? Because I always say your body doesn't know the difference between massage and exercise, other than massage will never make you stronger, but both massage and exercise produce fluid exchange. They increase the health and the mobility of the soft tissue. That could be muscle, tendon, ligament, and they just generally kind of desensitize the area because right now there's a lot of sensitivity that's going on. Depending on how you do it, and most likely you're using a walker. Pretend that I've got the walker, right? So you stand up, you push up from the chair. The foam roll is kind of my second tool of choice. Now I could use it sitting down. So let's say I just finished my rolling pin. I take my foam roller. I want to make sure that you guys can see it. I put it down on the floor. I come in here. I kind of get close to my end available range of motion. I don't have to pull into my end range. I don't have to stretch the tissue, feel pain in the tissue. This isn't about increasing range of motion. This is about facilitating the healing response. So with the ball of my foot up, my heel on the ground, what I'm doing basically is just a simple ankle pump. You guys have been doing ankle pumps already. You were doing them laying down. Now you're just doing them in a seated position. I could do it with the dome up. I can also do it with the dome down. And so now typically what's going to happen here is as I'm pumping it, it's going to want to kind of sneak away from me. So this is where you can use either your pant leg, or you can get a strap, or you can just grab underneath the thigh. And so the whole idea is I kind of slide it back as I'm working that ankle pump. And if you notice, if I kind of come close to my end range of motion, when my heel drops down, my knee actually bends a little bit more. So this is a great one. You can combine it with a little massage to the thigh so that every time you bring that heel back, you bring the roller back toward you. And this kind of just lets the nervous system calm down. You should not be pushing through the pain, but you should just feel that kind of muscle activity, nice and comfortable. I like to do it front to back. I also like to do it side to side. And so what I'll do, the dome is down, I put my foot flat on the top, and I roll from neutral to out, back to neutral. I don't roll in. There's no real benefit to stretching the inside ligaments, but just this motion, what it does is it gets my tibial bone rotating and pivoting just a little bit within the available pain-free range of motion. So any kind of motion that knee is going to experience when you're walking, we want to kind of replicate that. So I'll do 10 to 20 side to side. I'll turn it around. I'll do 10 to 20 front to back. Most of the time that's going to be within the available range of motion, not pushing the flexion or the extension. Now the other one, what I was getting at, was I can place this. I usually will have something that I can hold on to, like a kitchen counter or a wall. But basically, I'll place this on the ground, flat side down. I'll put the ball of my foot on the middle of the dome. I'll put my heel on the floor. And all I'm doing is I'm shifting my body weight forward. I feel it stretching through the calf and the back of the knee. And then I relax. Initially, you're not going to have the knee extension to get it totally straight and tall, but that's okay. I'm focusing on the calf muscle and the ankle more than I am the knee right now. And so I shift into it, I shift out of it. There's a little bit of kind of a rhythmic sway. There's a time to hold a stretch for 30 to 40 seconds, but there's also a time to kind of move through the range of motion. And that's what we're doing right now. And so while I'm stretching the surgical side ankle, then typically what I would do is I would switch and I would stretch the non-surgical side ankle. Because the reality is this non-surgical side is carrying most of the load right now. So we need to keep this nice and healthy. I would do the rolling pin on the non-surgical leg. I would do almost everything you do on the surgical leg. I would do it to the non-surgical leg as well. In this position, we've got flat side down. I can flip it, and now I can work that ankle pump motion, but I can combine the knee extension with it. And so this is a great way to just get that muscle working, kind of wake up the muscles that have been put to sleep with the anesthesia and inhibited by the pain. When when a joint hurts, the muscle gets inhibited, which means it just doesn't work right. So we need to kind of get the joint feeling better, get the muscle working again. I can press it down, I can shift onto it to get my calf stretch. I can do the non-surgical leg. The other benefit to doing the non-surgical leg is it forces you to put weight on the surgical leg. And so much of what we're doing at this point in the rehab process is about building confidence. It's about knowing what the surgical leg can do and what you feel like it can't do. So every time you shift weight onto that surgical leg, it builds just a little bit of confidence. You get some reassurance and you say, hey, okay, this handled it. Now, let's see what else I can do. And so big picture, kind of summarize, there is no right or wrong. We know we want to get you moving. We know we want to keep you on your feet. My favorite thing to do is say, look, if you're drinking enough water, you're guaranteed a trip to the bathroom every 2 hours or so. That's perfect. You're getting on your feet. You're going to the bathroom, whether you're using a walker or a cane. The idea is you're getting up, and nothing is going to replace getting you up and moving. I prefer short bouts of activity versus one dedicated long bout of exercise. So I'd rather somebody do, 2 to 3 minutes of the rolling pin, a couple minutes of the half foam roller movements, 5 to 10 minutes total. I'd rather somebody do that 4 or 5 times a day than have somebody really push it hard for 40 minutes and then be so exhausted that they can't stay awake for the next 4 hours, or they sit in a chair for the next 6 hours. Like, that's not the goal for anybody. So short bouts, moderate intensity, give your body time to heal. That first week to 2 weeks is really just about healing. You're not going to lose anything if you give yourself time to heal. You allow yourself to catch up on sleep. If you can find a position that's comfortable for sleep, that's probably more vitally important than just about anything else you can do. Eat well, drink plenty of fluids, do all the right stuff. Once you get through the first kind of roller coaster of 10 days to 2 weeks, then we can start to get a little more aggressive and you can start to push it. You have confidence in what that leg can handle. So I hope these little tips give you some ideas on what maybe you could start doing at home. This is definitely not a prescribed treatment program for you. You still need a professional. You still need somebody who can tell you what's safe and what's not safe, what you can do and what you can't do. My goal in these videos is just to expose you to some new ideas, some new concepts, maybe things that you're like, hey, I could do that. That looks like fun. Let's keep going. Post your questions. Let me know what you're thinking. Like this video on YouTube. Subscribe to the channel and ring the notification bell. This way you get notified as I continue to put out new videos. Thanks guys. Thanks for watching. I'll catch you in the next video.